Hello, this is Jamie Shear. Welcome to this presentation on the musculoskeletal syndrome of menopause, pharmacology and physical therapy treatment. This is for the Transitional Doctor of Physical Therapy program through the College of St. Scholastica for Pharmacology class 7710. The learning objectives for this presentation are listed here. We're going to talk about the phases and symptomatology of menopause. We're going to talk about the incidence and impact of menopausal sarcopenia. And if you don't know what sarcopenia is, you will hear in a minute. Identify pharmacological treatments or medical treatments for sarcopenia, and then also talk about the non-medical treatments of sarcopenia. We're going to talk about the status of menopausal hormone therapy, or MHT, sometimes also called hormone replacement therapy, or HRT, in the treatment of sarcopenia, and then also consider the role of physical therapy in the treatment of menopausal sarcopenia. The table of contents is listed here. This is what we're going to go over in the next 15 or 20 minutes or so. And we have a pretest here. How much do you know already? Maybe you already know a lot of this. Maybe you don't, that's okay. We will hopefully know it here in a bit. So what is the incidence of menopause? How many symptoms are there? What is even the musculoskeletal syndrome of menopause? What am I talking about here? What is sarcopenia? What are the treatment options? Medical and non-medical. We will talk about HRT and its effectiveness for the treatment of menopausal sarcopenia. And then how can physical therapy assist in the treatment of this condition? So just make a mental note of what you think the answers are. And if you don't, that's okay too. So let's first start with some definitions. So we've got perimenopause, which is the time leading up to menopause. It can start as early as age 35, and it usually lasts somewhere between 7 and 10 years. So women age 35 can start experiencing these symptoms. And this is leading up to menopause, which is actually just a specific day. It is one point in time that is exactly 12 months since a woman's last period. The average age is 51, and exactly 100% of women will go through menopause if a woman lives to be of menopausal age. I thought this statistic was interesting. Approximately 6,000 women in the US reach this menopausal milestone every day. And then postmenopause is referring to the rest of a woman's life after that one day of menopause. And it's important to note here that 30 to 40% of a woman's life could be spent in the postmenopausal phase of life. And then also, I think the terms menopause and postmenopause are kind of used interchangeably in this area, in this field. So just kind of know that. Here are some symptoms of menopause, kind of all over the board, anywhere from dry mouth to the typical symptom of menopause, which is hot flashes. That's the one that most people hear about most of the time. But night sweats, fatigue, depression, poor sleep, brain fog, inflammation, it's kind of all over the map. I don't think there's a body system that isn't affected by the symptoms of menopause as I've been looking into it. And according to Talulukar in 2022, menopausal symptoms affect approximately 80% of women. I don't know who the lucky 20% are, but 1/3 of those women, the symptoms are severe. We're going to funnel those symptoms down into the specific musculoskeletal syndrome of menopause that I began with, otherwise called MSM. And so all of those different body systems can be affected, but we're specifically looking at the musculoskeletal system and how it's affected by menopause. So according to Wright et al. This year in 2024, the 5 signs of this condition are inflammation, which is led by the decrease in estrogen. Actually, every cell of a woman's body has estrogen receptors on it. So when that estrogen decreases and is depleted and eventually gone for the most part, there's some inflammation that happens. Then there's the sarcopenia that happens, which is the muscle loss associated with aging, and decreased satellite cell proliferation. That is the ability to make new muscle cells. There's also osteoporosis within this condition, which is the loss of bone density or bone strength, as well as arthritis and or arthralgia, which is joint pain. So if a woman has all 5 of these, then that is considered, she would be considered to have the musculoskeletal syndrome of menopause. Dr. Vonda Wright, who is the head author of this article, states here that 70% of women will experience MSM during menopause, and 25% of women will be disabled by MSM. Now, it is a little bit unclear whether the 25% is referring to the 70% of women that will experience the condition, or whether that is 25% of all women. And Dr. Vonda Wright is actually very active on social media and Instagram. And I actually did try to reach out to her through Instagram to see if she could answer this question for me, but I have not heard back. And I don't know if I will, maybe I will, but she's a busy orthopedic surgeon in Florida. So we'll see if I do or not. So obviously all 5 signs of the musculoskeletal syndrome of menopause, they are intricately related. But what we're going to do here is funnel down even more and focus on the particular sign of sarcopenia. And I've got a couple of definitions here. I liked them both, so included them. So Katalkar in 2019 stated that sarcopenia is age-related muscle wasting and loss of muscle function, which is accelerated by the loss of estrogen during menopause. And then also Ormsby et al. In 2014 stated that sarcopenia is skeletal muscle mass and strength that has declined to a point in which health is affected. I added functional here in parentheses because that is what we as physical therapists are able to treat. What we are most concerned with is the functional health of our patients and how that affects their mobility in their daily life. From a cellular level, sarcopenia is a combination of a few different things. So we get atrophy or, a weakening of the fast twitch muscle fibers, the type 2 fibers. We get a decreased number of motor units within the muscle, and then we get an accumulation of fat within the muscles as well. Sarcopenia, it increases in women around the age of 50, which makes sense according to what we were talking to earlier with the average age of menopause being 51. That muscle weakening, wasting starts happening around that age as well. In men, it also happens as well, but not until around the age of 60. So this is an unfortunate statistic here, piece of evidence or information that women age 50 and over can be expected to lose between 0.6 and 2% of their muscle per year. And I would like to add that we can expect that only if we don't do anything about it. So we'll talk more about that here in a bit. Sarcopenia. It is a condition that is only somewhat newly associated with estrogen deficiency. Doctors and researchers are only recently starting to say, hey, this really coincides with the onset of menopause, and how much is this a menopausal symptom versus just an age-related symptom. And sarcopenia, if not addressed, it can progress to frailty and what is also termed as sarcopenic obesity or sarcobesity. Khadija in 2019 coined this term sarcobesity, and that refers to the combination of low muscle mass with a higher body fat percentage. And then we go deeper into the rabbit hole of combining words together, I guess. Osteosarcopenic obesity is the condition of interconnection between osteopenia or sarcopenia, which is the muscle loss, the osteoporosis, which is the bone loss, and obesity. So having all of those three conditions at the same time can be called osteosarcopenic obesity. And then Register et al. In 2016 called the two conditions of sarcopenia and osteoporosis twin conditions because it's really not known whether one causes the other or if they just happen to occur at the same time. It's kind of like the age-old question of which came first, the chicken or the egg. We're not sure, but they do happen together. Kadilkar in 2019 also notes in his article that sarcopenia is made worse if going into older age with these 6 things in place, if a person has increased inflammation, oxidative stress, mitochondrial dysfunction, increased apoptosis, which is cellular death, reduced physical activity, and poor nutrition. So of these 6 things, I would say that the first 4 are affected by the last 2. If we can alter our physical activity and nutrition, then that can have a positive effect on those first 4 things going into older age. So let's go into the treatment of sarcopenia here. First, the pharmaceutical treatment. So Rolland et al. In 2023 wrote an article looking at, with basically describing all of these different things that have been looked into to see if they could pharmaceutically treat muscle weakening, muscle wasting with age. And so they've looked at testosterone, selective androgen receptor modulators or SARMs, estrogen or HRT, hormone replacement therapy, which we will talk about here more in a bit, and all these other things like DHEA, which is a hormone precursor, growth hormone, vitamin D, angiotensin converting enzyme inhibitors, beta blockers. The conclusion of this article and study was that several of the pharmaceuticals proved to increase the lean muscle mass in patients, but that increase in lean muscle mass did not turn over or carry over into any improved physical activity or functional mobility scores, unfortunately. And so next here, we'll take a look at a specific study that showed just that. So in a study by Rooks et al. In 2020, this drug called bimagrumab was tested for the possibility of treating sarcopenia. This was a study that included men and women. The participants were 79 years old, plus or minus 5 years. 159 people completed the study. 113 of those people were taking the drug, and 69 of those people that were taking the drug completed the study. 52 of the placebo group completed the study. They had 5 different methods of measuring the functional mobility scores, and the body BMI of the participants measured by DEXA scan, and then the patients just self-reported on their falls, which is a possible limitation of the study. The results was that after 24 weeks, the participants in the treatment group that were taking the drug actually did have an increase in muscle mass of 2 kilograms, but they also had an increase of 3.8 kilograms of fatty body mass as well. So regardless of the increase in muscle mass, it did not result in an increased strength or functional mobility improvement in the participants. What they did see was that since both groups, the control and the treatment group, were instructed in exercise and adequate protein intake, was that everybody actually improved the same amount. The people taking the drug did not improve by any more than the control group. The next slide here, we actually get into looking at hormone replacement therapy for sarcopenia in menopausal women by Kim and Kim in 2020. The study was in Korea and included 4,233 women. They looked at their appendicular skeletal muscle mass as measured by a DEXA scan, divided that by their weight, and then compared that to healthy adults between the ages of 20 and 39. They separated these women into 3 different groups: women that were taking no hormone replacement therapy, women that were that had used HRT for less than 12 months, and then women that had used HRT for longer than 13 months. They adjusted for all sorts of things here listed. And then the conclusion was that the sarcopenia, so the muscle loss, was statistically lower in the women taking HRT for greater than 13 months. They did also note that these women that did show the improvement with the HRT, they were under the age of 65 and they had a relatively good BMI of 25. The next study that looks at HRT in postmenopausal women was a systematic review and meta-analysis by Javed et al. In 2019. This included 12 studies with a total of 4,474 participants. The average age was 59 plus or minus 6 years. There were 22 treatment arms, one of those being a control. And they used either DEXA scan, dual photon absorptiometry, or bioelectrical impedance analysis imaging. 7 of the treatment arms showed that there was actually a loss of lean body mass with HRT, and 14 treatment arms showed a protection of lean body mass with HRT. So not necessarily a gain, but a protection of lean body mass. Overall, the HRT users lost less low body mass than non-HRT users. The wording is very specific here. They lost less while using the hormone replacement therapy. So the conclusion of the study was that it was not a statistically significant finding. There was no specific benefit or detriment to the lean body mass with use of hormonal therapy. And even though that we know that the retention of muscle mass is crucial with aging, we do need to consider other interventions. So now that we know that the role of hormone replacement therapy, specifically for the prevention of menopausal sarcopenia, is questionable and it's not distinctly defined, and we know that there's ongoing research, that there's a need for ongoing research into this area, what can we do next? Where does our mind go next? And the pictures here give some clues. So if HRT doesn't have a significant role in the prevention of menopausal sarcopenia, how can we best slow and or prevent the loss of muscle as women age? Let's take a look at it. So the non-pharmacological treatment of menopausal sarcopenia by Svensson et al. Looked at the ability of women to gain muscle strength regardless of their menopausal status. Now, none of these women were on HRT in this study, but I think it's important to look at because they included women who were pre, peri, and post-menopausal, and you can see their ages here, how they divided them into different age groups. There were 25 women that were instructed to continue with their current level of activity, don't change a thing. And then there were 45 women that were put on a supervised resistance strengthening exercise program 4 days a week for 12 weeks. They were measured before and after with these methods here for strength, flexibility, muscle thickness, and then body composition with a DEXA scan. And the results were that all three groups of women in the supervised exercise group had improvements in every area that they tested. There was no differences between pre, peri, or postmenopausal women. And the conclusion was that all women can benefit from an exercise program, irrespective of their menopausal status and or their hormone replacement status. Another study that I looked at here was the effects of yoga on menopausal sarcopenia. So what can we do without medication to prevent this and or reverse it? So Wang et al. In 2024 did a systematic review and meta-analysis of randomized controlled studies. They included 10 studies involving 989 participants, looking at yoga interventions for women who were experiencing menopausal symptoms. The results were pretty good here. Yoga has a significant beneficial effect on all of these aspects, psychological, somatic, urogenital, such as urinary continence, sleep quality, anxiety, depression, blood pressure, and then most specifically here for what we're talking about today is an improvement of body mass index, meaning an improved lean body mass, improved strength, improved muscle mass, decreased sarcopenia, right? They did not find any significant improvements for hot flashes with yoga. And then they also said there were no improvements with overall quality of life. I put the question mark there because in my thought, if all these other things are improved by yoga, then I would say for me, that would be an improvement of my quality of life. So wondering why they said that there, but that was just an interesting thought. So now we come to the physical therapy treatment during menopause. So what can physical therapists do for women who might be experiencing the musculoskeletal syndrome of menopause? A woman might not have to have all 5 of those signs and specifically have that MSM diagnosis. But as physical therapists, we can do a lot. This is what we do. This is our wheelhouse. We can address the muscle weakness that is caused by sarcopenia, either before it has progressed into a clinical diagnosis of sarcopenia or after. Either way, the study that we talked about a minute ago said all women can benefit from strength training, no matter where they are in the menopausal transition. If the sarcopenia, if the muscle weakness has progressed clinically to where the patient is having balance problems or falls, we can definitely treat that with balance training, strength training, fall prevention, education. Joint pain can be treated, and joint weakness, strengthening the joint around a painful joint can help decrease that joint pain. And then going back to the study by Dr. von der Wright, where she said that 25% of all women will be disabled from the musculoskeletal syndrome of menopause. Those 25% of women might end up needing a total joint replacement, whether it be knee or hip or shoulder. And that's where physical therapy definitely comes in, is in the treatment of those post-surgical rehabilitation situations. And then also a big area that we can address as physical therapists is just educating women who are of perimenopausal and or menopausal age of how the dropping estrogen in their body is going to affect them and their musculoskeletal system, and how to decrease those symptoms during this period of their life with strengthening exercises and changing of lifestyle factors as needed. And they can help mitigate the sarcopenia regardless of whether they have chosen to use hormone replacement therapy or not. So now we get to the conclusion and takeaways from this presentation today. So hopefully we know by now that menopausal will affect all women 100% as long as a woman lives to the age of menopausal years. Menopause has many symptoms. I have seen, 35 plus in researching this, depending on who's listing the symptoms and how far they break down each symptom. Perimenopause can start as early as 35 years old, and the perimenopausal timeline can last anywhere between 7 to 10 years. The musculoskeletal syndrome of menopause will affect approximately 70% of women. 70% will have all 5 of those symptoms that we talked about earlier. And sarcopenia will affect all women as a natural part of aging. Hormone replacement therapy may be somewhat helpful in slowing age-related or menopausal-related sarcopenia, but more research is needed for that specific symptom of menopause. HRT might be, beneficial for other things, but specifically for sarcopenia, it's questionable. But we know that the lifestyle factors, including exercise, strengthening exercise, and maintaining a healthy BMI, a healthy body weight, will reduce age-related sarcopenia. So the post-test here, we basically just answered all these questions on the last slide. Hopefully we know all the answers to these questions now. And here are the references for this presentation. I thank you for your time. I appreciate you watching this presentation, and I appreciate any feedback that you wish to provide. Thanks a lot. Bye-bye.